Hi there, ladies and gents. My name's Anthony. I'm from thebodymech.com. I'm primarily a personal trainer who doesn't really personal train anymore. I'm actually more of a biomechanics coach, so looking at how we can assess function, look at how the whole chain works in unison, and how we can track compensations and all that fun stuff. So I wanted to create a video based around what we call a leg length discrepancy, and how this can potentially change how the whole body functions, how it can increase loads through certain areas, and then obviously from that can start to cause injury. It's not something we really hear about at all within the personal training industry, and it's something that's not really discussed in great depth within the medical industry. So hope you found this video interesting, and let's go. So first things obviously come first. So we got here, this is the human pelvis, mostly comprised of two anomalates. So we got the right side and the left side. They form with the sacrum the SI joint. So the SI joint, got to unclick that again. So the SI joint basically is this little joint just in the front here where the anomalate joins onto the sacrum. What we've got in this area is, I can't take it off on this particular program, by the way, this is 3dtoad.com I'm using here, which is a nice fancy bit of kit, and free, yay! So what we've got here is these two sections can, when they come off, they look like a bit like a human ear on the inside. So it kind of locks together, and it's almost like a bit of a ratchet kind of system going on. Very clever. Anywho, so we've got here two sides of that. Two SI joints equals two sides of the pelvis, which up until only recently I understood, I say probably recently, about 3 or 4 years ago, when I started looking more into the biomechanics side of it, these two sides of the pelvis can move independently of each other. So the right side here can tip down and forward, whilst the left side going up and back. So you can get like a rotation in the pelvis. And obviously this all comes from the SI joint, but also a bending and a flexing of the pubis symphysis just in the front here. So the issue with the pelvis is that it's surrounded by a load of muscles, particularly one called piriformis, that are very protective. They're a bit like airbags. Similar with the shoulder, there's one called infraspinatus that is the same kind of system with piriformis. We call them the four pillars, so they kind of do this whole protection mechanism of the extremities. The issue with piriformis is it's very, very, very sensitive to anything that goes on around the SI joint, but also sort of anything with the pelvis. What can happen is, because it goes from these two areas here, it locks down on this SI joint and stops it from moving correctly. So to regress slightly, if we lift the right leg up, so knee towards chest, then this part of the pelvis will tip up and backwards. It will kind of go up and back. And the sound effect helps, by the way. If the leg was going to more an extended position, so the hip joint went that way, then the pelvis would drop down and forwards. Now, as it goes down and forwards, the acetabulum and the head of femur will drop very slightly. I mean, only maximum, or I say maximum, everyone's individual, but the common number we see is around about 1/4 inch. Not very much at all. And when it goes up and back, then the similar happens, but it's the other direction, so then it'll come up again, around about commonly known as 1/4 inch. The issue happens when piriformis gets a bit scared. Piriformis will go, oh, hang on a minute, that's a bit further than I'm used to going, or this is a bit further than I'm used to going with the SI joint here. I'm going to stop it there, and we're not going to allow that to go any further to protect it and to do my job. So if, for example, the pelvis has gone down and forwards, and for some reason piriformis hasn't liked it, it will lock up and that joint will stay in that position. So when we then go to stand up, or if we're already standing up and the body had to compensate for this, then this femur is down, hanging a bit lower down than it should be. When we go to stand on level ground, then this will push the whole pelvis up on this side. So say, for example, it then goes up to the top of my arrow, just there. So imagine the pelvis has been pushed up to that point. The other side of the pelvis will probably stay where it is. So then you've got this like tilted pelvis thing going on. And this is what we've found to be what's called a functional difference in leg length. Is this whole SI joint locking mechanism causing the leg to seem longer rather than actually being a difference in bone length that you get from mum and dad. If you have got a difference in leg length and it's nothing to do with the pelvis, and we can screen for that, then you can blame your parents. But until then, we don't really know. So we'll usually do a screen and we'll find out whether it's functional or genetic. And there's exercises that we can do around the functional side of things. And obviously, there's other professions out there that can deal with more the genetic side of things. So to get back to the difference in leg length, if the right leg was the longer one, what would happen in some cases is the knee will have to compensate for this difference. And what might happen is it will become more valgus. So then the knee may actually sort of go more medially to where, again, the outside of my arrow there, and bend in slightly, and then come back out to where it is over the ankle. We call this knee valgus, and sometimes you tend to see it on people who are very, very flat-footed because of the position of the pelvis and the rotation through tib and fib, etc. But also you can see any difference in leg length. So this longer leg may cause that knee valgus. With the foot as another subject, the foot actually might, the arch of the foot actually might decrease. So you'll become more flat-footed, potentially on that longer leg, because of the pressure going through the foot and how the body having to compensate, because it really wants to keep the pelvis level and the eye line level. Now, in the case that it can't keep the pelvis level, it will change how the spine moves and is shaped so that it can keep the eyes on the horizon. Alrighty, so what can happen there is a thing called scoliosis. Now, what scoliosis is again, there's two different kinds: the genetic version, where you're born with a slight curvature to the spine, or there's a functional scoliosis, where your spine's adapted for this potential difference in leg length here. So when we've got scoliosis or any kind of change in the structure of the skeletal system, say for example we've got this difference in leg length here, this pelvis is being hiked up at this side, means glute med. Now glute med goes from the iliac crest sort of more medially, more anteriorly here, then down onto the top of the greater trochanter. What it does leg abduction, but it's a major player in pelvic stability during movement, gait, running, cutting side to side, etc. If that isn't functioning correctly, then the pelvis can kind of drop to one side. It will kind of drop down because these 2 points get further away from each other. So with the difference in leg length, we'll go back to the front so I can orientate myself. This has been hiked up, so it means that this glute med is longer. This one's dropped down because this glute med is shorter. So we've already got an asymmetry in the musculature of the body as well. So because of a joint issue, we've now possibly got a muscular imbalance. There's another one we'll have a look at, which is the hamstrings. The hamstrings go from the back of the leg here up to the ischial tuberosity. But what we've actually found is that the tib and fib, they go all the way up to the shoulder. Now I hear you crying, that's not what my book says. Well, the books are correct in the way that the hamstrings do go from the tib and fib up to the ischial tuberosity. But what we found is that from most dissections, actually there's a link between the shoulder and the knee, even further down into the foot. So the hamstrings go from tib and fib up to ischial tuberosity. There's also a ligament that sits in this area here called the sacrotuberous ligament. Now that is basically a ligament that's there to help stabilize the pelvis, but also it's a great insertion point for muscles. That's then attached into this thoracolumbar fascia here, so there's a big white diamond shape you see on your anatomy books, and attached into that is your latissimus dorsi, and that will come up into the humerus just here and on that sort of that aspect of the scapula. So we've now found from humerus to latissimus dorsi, thoracolumbar fascia, sacrotuberous ligament, hamstring cervical tuberosity down tib and fib, that if, for example, the hamstrings were shortened for some reason, so they went into this protective spasm to protect something, which we found that most muscles have the ability to do, then that may change how the whole chain is affected. So you may have, for example, a shoulder pain issue, but it could be coming down from the hamstring. And this hamstring issue, or this protective mechanism, could be due to this difference in leg length that we were chatting about earlier on. So because the pelvis has changed, that's changed how the hamstring functions, that's then changed how the thoracolumbar fascia interacts with latissimus dorsi, and that's then changed how the shoulder functions. So you can kind of see how it may be that someone has a shoulder problem, but it's not actually anything to do with the shoulder as such. The main cause isn't in the shoulder. It's a compensatory mechanism that's caused their pain. That's about as far as I'm going to take it for now. What we're going to do in the next video is take it a bit further, look at some more pictures of clients with difference in leg length, and discuss more about the anatomy and how this can happen, and start to build in some of the nervous stuff as well, so how the nerve can cause compensatory mechanisms that then can cause issues with the spine, and etc, etc, etc. So if you liked the video, then click like, comment in the bottom, and check out www.thebodymech.com for courses and how to screen for these kind of things. Over and out, and catch you soon.